are over here at Dr. Rizik's office, getting ready next week for the third heart procedure here. We have Dr. Burke, who we've met in the operating room before. I do want to say we are wearing masks because we're actually over in your office area that's not near the hospital, but still on the HonorHealth campus, and we're honoring what they have in place here about, of course, making sure that we're wearing masks and safe. So that's why even inside, they want to make sure that even though we're not at the hospital. So how are you, Dr. Rizik?
Doing great. It's great to be with you. Great to have Dr. Burke with us on the show.
So, okay, we're literally a week away. And we're getting ready, and this is one of the items they're going to be seeing in the operating room, but also on the show. We're going to show how this works, but very quickly explain what this is.
This is the device that we use to, in essence, perform a non-surgical catheter-based valve replacement. In other words, as we've talked about, most valve replacements up until about a decade ago were open heart surgery, where you cut the chest open and replace the valve that way. This device allows us to go up through the leg, not open the chest at all, pass a long tube up to the heart, and implant a new valve non-surgically, without ever opening the chest, implant a new valve, and these patients then, about 90%, go home the very next day.
Wow, amazing. You know, I don't know, where did I put it, where I wanted to show them what this piece looks like going in. Do we have one, right, Dr. Burke? Can we bring one over? As he's grabbing that, let's talk about how, again, what we're saying maybe 10 years ago, a little less than that, that we wouldn't have saw this type of technology, would we?
No. Heart surgery and heart procedures were the historic domain of the surgeons, but through some really incredible engineering and manufacturing, we have gotten to the point that 90% of these procedures are done non-surgically. Maybe Dr. Burke could explain what this valve is and what it looks like.
Okay, so that's what we're going to be placing in some way, correct?
Correct. This is a Medtronic valve. It's a core valve, or now an Evolute valve. And what it is, it's a nitinol frame. So nitinol is a memory metal. So you imagine you could put this straight into somebody's artery and expect it to move anywhere. It's very large, but it will actually compress down, and we can make it much smaller, and it will end up on the tip of that catheter, and it'll actually get compressed onto there, and then we can go and thread that catheter all the way up to the heart. It will then be released from the bottom to the top, with this bottom part anchoring it into the annulus of the aortic valve. And that allows it to stay there and actually push the diseased valve tissue out of the way, so that at the end you have this nice big opening that blood can go through again.
Wow. And this type of surgery is definitely a life-saving surgery for a lot of people.
This is a life-saving surgery. It's done minimally invasively, so the stroke rates are much lower than traditional heart surgery. The length of stay in the hospital is generally about 24 hours as opposed to 5, 6, or 7 days with surgery. When you look at the patients who receive this non-surgical catheter-based replacement, it saves lives, so they live longer. It improves their quality of life, their everyday stamina and exercise tolerance, but also it reduces the number of hospitalizations that they have for this type of aortic valvular disease.
Wow, it's amazing. Okay, next week, I want to say you're going to see a couple of different faces that we've are going to have compared to our other two procedures, is because this is kind of like, not the first time, but it is very a big time that you have brought in different people to do this, because usually it would just be one person here, you would be over there, whatever, like that, doing different things. This is a group effort.
This is a real team effort. Dr. Burke does an incredible job with giving us imaging so we know where the valve should be. There will be a cardiologist and a surgeon working the knobology on this device. So it really is a team effort. We have an anesthesiologist at the head of the table who puts the patient to sleep. We're very much interdependent on teamwork, much like a basketball team or a football team.
That's amazing. All right, so I like always closing the interviews with tips on preventing heart disease, because that's what you're very much about. I know this is your work, but you'd like to be able to not have to do this work all the time.
Well, Dr. Burke does a lot of our preventative cardiology for the group. What are your main tips for patients to prevent having heart disease so that they don't end up in the operating room?
Well, nobody wants to end up in the operating room. That's pretty simple and pretty straightforward. Most of this stuff you've heard before. It's really a matter of eating healthy, keeping yourself physically active, paying attention to those things that we can change. And stay in touch with their doctors so that they can actually be followed for those things that really require blood work or something else to let them know where they are.
And never pick up a cigarette.
That's a big
Don't
one right
smoke.
there. There it is. Dr. Rizik, Dr. Burke, I'm very excited. Next week, right here on AZTV 7, 8 a.m. is another live heart procedure where we're going to be doing a aortic valve replacement. So you're going to want to set the clock, set your times, be here for it. 8 a.m. September 23rd here on AZTV 7.